have Dr. Simmons here waiting right now.
Each year in this country, over 3.5 million people are involved in auto accidents. At least one accident occurs every 31 seconds, and every 6 minutes, one person is killed as a result. According to these statistics, each person living in this country will be involved in an automobile accident at least once in their lifetime.
Somebody will run into us, even if we're very, very careful, or we'll slide off the road in a snowstorm or something.
Those who do not lose their lives are torn, battered, and bruised, and require medical treatment. Of those victims who are treated, nearly 44% will never be the same and will live out their lives in pain. The vast majority of those lingering injuries result from one single ailment. It's an ailment which threatens the well-being of anyone unfortunate enough to suffer the injury. According to doctors, paramedics, and emergency room personnel, this ailment now threatens to become a widespread epidemic. Today, a special report, Whiplash Epidemic. What happens to your body when you're involved in an auto accident?
I think that anybody who's been in an auto accident only has to take a look at their car to realize the kind of force that their body has been subjected to. And those forces translated into the skeleton, particularly what we call the axial skeleton through the back and the neck, lead to misalignment, subluxations, as the chiropractors call it.
While many accidents are considered minor, the victims of these accidents will be the first to tell you their pain is anything but minor.
There was excruciating pain from my head to my feet.
I mean, I was in bad shape. I couldn't hardly walk.
Intense pain at the top of my head, and slowly it just went down all the way to my tailbone.
I said, whoa, somebody beat me up in my sleep?
So even if there is little or no damage to the vehicle, an accident at a very low rate of speed many times results in major injuries.
If you're driving along and in a vehicle and you hit something, you leave the seat and come forward and then slam into the dash, the steering wheel, and the windshield with your knees, your chest, and your face. All of this happens in less than 1/10 of a second.
Even with seatbelts, airbags, and other supplemental safety restraints, a person cannot escape injury.
You will be sore. People have said that to me. They get in even a 30-mile accident with their seatbelt on, and the paramedics and scenes say, okay, you look okay, sir, but you're going to be sore tomorrow. And they, oh, no, I feel fine. The next day, they can hardly walk, especially as we get older. And they're sore.
And according to medical experts, the injury which occurs most frequently is damage to the spine as a result of what is commonly referred to as whiplash.
Whiplash is a serious condition. Oftentimes, people will get involved in an accident. This is a plastic model of the spine, and it'll throw the bones of the spine out of alignment and do serious tearing to the ligaments that hold these bones together. And if it's allowed to heal crooked, the spine will.
Dr. Stephen Vicentin of CARE Chiropractic is one of this country's leading chiropractic authorities on the effects and treatment of whiplash. Dr. Vicentin knows firsthand just how prevalent the condition is.
This year, over 3.65 million people will be involved in this whiplash epidemic. They say that 1 in 10 families will be involved with whiplash. And if it's serious, over 50% of those people will never recover. It is an epidemic.
Over the past 15 years, Dr. Vicentin has treated thousands of automobile accident victims who have sought specialized care for whiplash and the many symptoms brought on by this injury.
Oftentimes they'll have headaches that they never had before, or they'll notice blurred vision or stiff neck or soreness in the neck. Or they might notice numbness and tingling into their arms and hands and fingers that they never had before. Mid-back pain, lower back pain, numbness and tingling down into their legs and feet. They might have difficulty sleeping at night or remembering things, feel fatigued and irritable. They might notice their jaw pops after an accident.
Dr. Vicentin and his staff are dedicated to permanently alleviating the pain and suffering generally associated with whiplash. Each day, patients from all walks of life visit CARE Chiropractic with one thing in common. They are all victims of spinal injuries.
This drunk driver, he came behind us and he hit us and we almost crashed into a store.
She just swiped us and it was devastating.
A car was being chased by the police. We were in a parked position. The car came around the corner and totaled out our car.
One of those patients is Dr. Judy Paley, MD, an internal medicine physician.
Well, my relationship with him began as kind of a fluke. I felt that as a 90s sort of doctor, I ought to experience chiropractic care just so I could give a good answer to people who were asking about it. And Dr. Vicentin was right in the neighborhood. I picked him by his storefront. So I first came to him about 5 years ago, and my only expectations at that time were that I would discover that chiropractic care really had nothing to offer and that even had the potential to cause harm. And on my first treatment, I discovered that, in fact, it was so gentle and innocuous there was no way that it could cause harm. But for those same reasons, I left here believing that there would be no way that this would cause any benefit. And yet the next morning when I woke up, a lot of the aches and pains that I had experienced over the years were gone. And that was the start of a long relationship, both personal and professional, where I have continued to come both as a patient and to refer patients here.
But oftentimes, many physicians attempt to treat victims of whiplash with medication or physical therapy instead of referring patients to proper caregivers like Dr. Vicentin. What results is merely a temporary treatment, which only addresses the symptoms and not the cause of the pain.
Oftentimes people are sent by their insurance company or an attorney to a doctor that the insurance company knows or the attorney knows, and as well-meaning as those referrals are, oftentimes those doctors are not up on state-of-the-art techniques to address this problem. The kind of care that most people are receiving is rather superficial in nature. It doesn't really address the cause, doesn't address the alignment of the spine and the interference that spinal misalignments can have on the nerve system that comes from the spine. And until that's done, they really won't be well. You can imagine that taking medication is not going to line the vertebrae of the spine up. It just can't do that. It's ridiculous. There's no way that taking drugs, and people have the idea that taking medication somehow is really going to help them. Oftentimes it slows down healing or getting physical therapy. That's superficial in nature. Oftentimes people feel momentary relief that really won't address the cause.
I think practically everybody can benefit from chiropractic care through our lives, injuries, accidents, pregnancies, posture, poor posture, the way we sit. We cause asymmetries in our skeleton and cause wear and tear in various spots. And probably everybody, if they had the time and the money, would benefit from chiropractic care. But I certainly refer people who come to me with back pain, shoulder pain, hip pain. I've found that he even can make a difference for things that I wouldn't have thought about previously, such as a torn cartilage in the knee.
Oftentimes people will go for therapy or take medication, and that's just superficial. It never addresses the underlying cause of whiplash, which is bones out of place, pinching or interfering with the nerves that come from the spine. Until those bones are gently realigned, that patient will suffer, sometimes over a lifetime. They say that in serious cases of whiplash, that over 50% of those people suffer lifetime, permanent damage to their spine, to their nervous system, and pain that follows these injuries. So it's a very serious condition. It involves the spine, and particularly the nervous system, and we're doing state-of-the-art techniques to take care of these problems.
Dr. Vicentin, a pioneer in treating injuries associated with whiplash, utilizes a pain-free, high-tech method of treatment. Next, you'll watch as Dr. Vicentin uses this revolutionary method to give his patients quick relief from the pain that many of them have suffered with for months. Special report, Whiplash Epidemic, will continue in a moment. If you've suffered a whiplash injury in an automobile accident, waiting to get better is dangerous. Your problem may get worse, doing permanent damage to the spine and nervous system. Don't wait. You can feel better today, and feeling good is what life is all about. Call Dr. Vicentin at CARE Chiropractic for a free exam now at 394-CARE. If he cannot help you, he will tell you so. Relief is just a phone call away. Just pick up the phone and dial 394-CARE. Call now, 394-CARE. That's 394-CARE. You have nothing to lose but the pain. You've had an automobile accident and you're injured. Doctors in the emergency room release you after a cursory exam and a prescription for potentially dangerous drugs, telling you you'll be fine in a few days. But you're not fine. You're in pain and you don't want to subject yourself to the drugs they prescribed. So what do you do now?
They should act immediately to get a proper examination. The examination done at the emergency room, it's an examination to determine whether to hospitalize you or not, whether you're going to live or die. Our examination is much, much more extensive because it determines how you're going to live and what the cause of the problem is. And it's designed to address the cause of the problem, to reveal what the problems might be, which bones are out of alignment, so that we can gently realign the spine and allow the body to heal itself. Once the body's in balance, it can heal itself. It's a self-healing organism. That's how the body works. So we work with the body's own natural healing mechanisms to make sure that people get the right kind of care. So what kind of symptoms are you noticing, Jessica?
Well, basically, it's headaches. I'm even getting numbness in my arms and dizzy spells. Mostly the headaches and pain in my neck.
So the number one problem is the neck. And how does it feel?
Stiff, painful.
All right.
It's tough to move around.
All right, it's locked up. And how about your headaches? How would you describe them?
Oh, severe, like stabbing pain in the temple area mostly.
Right. Looks like we've got some work to do.
Oh, yeah.
And you mentioned other symptoms as well. You talked about your back. You told me about that. And how does that feel to you?
That also keeps me from being able to do day-to-day activities. I mean, I used to bike and run and be very active, and I haven't been able to do any of that, and I'm gaining weight.
Oh, boy. So here you are. You're normally an active person.
Right.
And
I mean, the doctor.
this is all related to the accident.
Right. I've been to a doctor, and he's given me pain pills and muscle relaxants, but that's is a short-term thing. It's not helping me in the long term.
Are you noticing numbness or tingling down in your arms, hands, or in your fingers, or numbness down the legs as well?
In my fingers and in my legs, yeah.
Any difficulty swallowing, or jaw clicking? Any problems like that?
A little bit.
How about chest pain? Have you noticed that as well, or difficulty breathing?
Not
restricted
a whole
breathing?
lot of that. Maybe restricted breathing, yeah.
We're going to do a thorough examination.
Okay.
Orthopedic, physical, neurological, structural. We'll find out exactly what's wrong. And we're going to take some pictures today. You're not pregnant, are you?
No.
Okay, we're going to go ahead and take some pictures because it's important to find out exactly what's wrong. Our methods realign the spine gently, effectively. They're very safe and extremely effective, high-tech techniques that just do wonders for people like yourself who've been involved in accidents, who suffered pain and misery and have been everywhere else.
Well, that would be great.
The first thing we do is examine our patients very thoroughly, particularly after an accident. We do over 150 different tests to examine the spine and particularly its alignment. And then we do some x-rays if it's necessary and only if it's necessary. After the examination, we explain exactly what's wrong to the patient and their family. We go over the x-rays with patients. A lot of times doctors, I don't know why they do this. They don't show patients their x-rays. We love to show patients their x-rays because oftentimes they can see the problem and we want them to know exactly what's wrong and give them the best of everything when they come in. You got some problems and we definitely have work to do. I want to let you know today what's wrong, what we can do about it, how long it'll take, and let you know that your insurance will cover for your care here, that you don't have to worry about that. We work with all the insurance companies, and all you have to concern yourself with is getting well. Today I wanted to show you that a normal spine, looking at it from the side, has a good curve to it from the side. People don't know this, but the neck should have a nice, clean, even curve looking at it from the side. So this is a side view of a normal neck. Here's the back of the head, here's the jawbone, and we're looking at the neck from the side, and you can actually see a beautiful curvature there. I put up your x-rays so that you could compare your x-rays with the normal one. Can you see the difference?
Yeah, it's not curved at all.
Yeah, we got some work to do. You can see that this is not right, this situation. There's an actual reverse. If you look carefully here, the bones are so far out of alignment that there's a reverse in the normal curvature that the neck should enjoy, and that's serious, and it's just the kind of thing that we help here. Left alone, by the way, this will degenerate over time. It'll get worse. It'll even cause arthritic changes in the neck. It's causing your headaches. It's pinching on the nerves that go up into your head. It's causing that numbness and tingling. You're feeling the stiffness and soreness in your neck, and many of your other symptoms. When we get this lined up, it'll feel wonderful for you. You won't believe the difference. Oftentimes people will delay care because they're afraid that it might hurt to get well. And I understand their fear. I've been there. I had these injuries myself. I know that after an accident, the last thing you want is someone touching you or trying to move your neck around or trying to move your spine around. You just feel stiff and you just want to be left alone. But that's the worst thing you could do because your spine might heal crooked and very often does after a serious whiplash injury. Please stand over here. Let's check you. Let's put you forward on this special table. When you're ready, lean straight ahead, and you'll feel yourself move forward in just a minute. Are you ready?
I'm ready.
Here we go. Alrighty, so you'll feel yourself move forward, and that's a little different as far as an experience is concerned. Bring your arms to your sides when you're ready. Take in a deep breath, and exhale. Just let it out all the way. Alrighty. Just let those muscles relax. Take in another deep breath, please, and exhale. There you go. Let's check you. We have a handheld instrument that gently realigns the vertebrae. It's completely painless. People report it didn't feel like a thing. They're always surprised about how gentle our care is and how effective it is. You happen to have a left short leg that gets shorter when I lift it, and that indicates that you do have vertebrae or backbones that are out of alignment. How's that feel right there?
A little tender.
Can you feel that's tender? Let's adjust your spine. Did that hurt at all? Alrighty. What we do at our center is gently realign the vertebrae. We do a painless technique. Oftentimes patients are very surprised that it didn't hurt at all to get their spine realigned. They say, whoa, that felt like nothing. And then the next day or the day after, they just feel wonderful. They'll notice a big change in how they feel. They'll start to get better. For the first time, maybe they've been to other centers where they tried to cover up the problem and never realign the spine or never address the underlying cause of whiplash. At our center, we do that in a high-tech way that's completely painless and very safe, gets tremendous results. You've been having headaches, you told me. You feel this up here? That's your headache bone. Looks like we should line that up too. What do you think?
Okay.
Yeah, let's adjust that. Let's set that bone in alignment so that you can start getting well. Pull both shoulders backward off the table. Relax. Here we go. Can you feel that this is a little tender too? Let's make that right for you. And let's adjust the ribs as well because you need it. Those muscles are really tight and that should give you relief. If you have nerve interference, if the bones are out of alignment, you can have symptoms in your head. You might have a headache if the nerves that move up into the head are interfered with, or you might have numbness and tingling in the arms, hands, or fingers because the nerves from this area of the spine, they go into the arms, hands, and fingers. You might lose your sensation or even your strength in your arms and hands. If these bones move out of place, you could have chest pain or trouble breathing. If these bones move out of alignment, you might have problems with your legs or numbness and tingling in the legs or even back pain. So you did very well. Go ahead, take a step back.
Yeah, it feels a lot more loose than it was.
Tremendous, you did great. I'm really proud of you. Your feet were way out of alignment.
Yeah.
And then after we adjusted you, they were right together even. You adjusted beautifully. I'm very optimistic about your case. You're off to a great start.
That's great. Thank you so much. My headache's gone.
That's amazing. Hey, you're off to a terrific start. Let's schedule some visits so that you can get well and stay well, huh?
Okay.
All righty.
All right, thank you.
You're welcome.
When a patient makes the decision to put their health in the hands of Dr. Vicentin, they do so with great confidence. Care Chiropractic has an extraordinary success rate of over 90%, a rate unparalleled in the medical industry. But for those of you who are watching this program and dealing with pain suffered in an auto accident, numbers and statistics probably mean very little. What will be meaningful to you, though, are the words of those who have been where you are, Dr. Vicentin's patients themselves. In just a moment, you'll meet several of Dr. Vicentin's patients whose lives he has improved so dramatically.
The relief was phenomenal. He's giving me hope that my back is going to feel better.
When I came here, it was just the best.
If you've been in an automobile accident and you're suffering from any of the whiplash danger signs, neck stiffness or soreness, headaches, back or hip pain, dizziness, loss of sleep, numbness in the arms or legs, or irritability, call 394-CARE immediately. Waiting to get better is dangerous. Your problem may get worse, doing permanent damage to the spine and nervous system. Don't wait. Call CARE Chiropractic now at 394-CARE. Relief is just a phone call away. Call 394-CARE. Call now. 394-CARE. That's 394-CARE. You have nothing to lose but the pain. You've heard Dr. Vicentin talk about how his pain-free treatment has helped thousands of people who have suffered whiplash injuries return to their active, pain-free lives. People who have tried other forms of treatment without any success. Now we want you to meet these same people and hear about the traumas they suffered and how Dr. Vicentin was able to restore their lives.
I had multiple strains, whiplash, you name it, I had it.
Well, after I got hit, all I had was a really intense pain at the top of my head, and slowly it just went down all the way to my tailbone.
Neck pain, headaches, both arm numbness, tingling, a decrease in dexterity.
Vertigo, headaches, I had nausea, chronic pain in my lower back and neck.
Vomiting and loss of equilibrium.
I went to the doctor, regular medical doctor, who said, no broken bones, here's some pain pills, go home.
Went through the whole gamut of doctors, x-rays, cervical disc, steroid injections, and this went on for about a year.
I just couldn't handle the pain anymore. It was horrid.
Man, I couldn't hardly move.
It was humbling, but it was also devastating to my everyday existence.
People might get rear-ended, God forbid, and their car is driven violently forward in a split second, and their heads are thrown back over the seat rest, the headrest, and the muscles in the front of the neck are ripped and torn. And then their heads bounce violently forward off the back of the seat, and it involves the entire spine.
Dr. V gently adjusted my spine as much as he could. I felt better. I was able to sleep that night. Also, I had insomnia, but I was able to sleep that night. The next day I came in and he adjusted me gently again. It was even better. And then the third day, I was able to walk without dragging my left side. I walked like Igor, bent over and just dragging everywhere. So I was able to stand up straight. That was remarkable to me without the aid of medicine, which is what I liked.
The relief was phenomenal because I could move my neck to much greater a degree. And thereafter, I was coming in daily for the adjustments, and the relief seemed to last longer. It was just a phenomenal thing.
It was almost an immediate thing. It was for sure the first day I felt relief, and each subsequent treatment gave me more relief.
It is painless. You feel better. It makes you feel, puts everything back together, you know, in the spine, and it just makes you feel so much better. Takes the pain away.
There's been like a threefold kind of thing that has happened. I think I get emotional uplift, spiritual uplift, and just an uplift.
Now you tell me what pills can do to help that.
We'll put people forward on a special table, examine their spinal alignment and the interference and impact that has on the nerve system, and we'll line up the bones and then bring them back off the table again. And they report to us that oftentimes they feel better after the first visit.
I've only seen him a month and a half now, and in the month and a half I've seen him, he's done more for me than the physiatrist did in 6-7 months.
I used Tylenol, Advil. None of them worked. You know, Dr. V, you're getting the right care right off the back. You know, there's no medicine. You can throw away all your pills, and, you know, just, he's the best.
He said, what am I doing for you? I said, you're making my nerve breathe. He said, I like the way you put that.
I couldn't hardly walk, but now I can walk.
Oh, gee, what a big difference. It doesn't really hurt as much to walk, and I can stand longer. And it's just made a big difference in my life, you know, the treatment that Dr. Vicentin has given me.
Actually, relief of every muscle and nerve in your body. I find Dr. V excellent, and like I said, he's a unique chiropractor.
Give him a week, pain will be gone.
When you suffer the trauma of an automobile accident, the most important thing to you is getting well, and getting well fast. That's all that should matter to you. At Care Chiropractic, the staff is trained to take care of everything you need so you can concentrate on healing your body, and that includes dealing with your insurance company.
We enjoy good relationships with all the insurance companies. We'll work with all the insurance companies. You don't have to get permission from your insurance company to come to our center. You don't need permission from another doctor to come here. We're primary portal of care providers, which means you can come to us first. We work with all the insurance companies. Insurance pays for this kind of care. You don't have to worry about that. In most instances, your care will cost you nothing.
They took care of everything. They made sure that they kept in constant contact with my lawyer, and they took care of all the paperwork. They talked to the insurance company. They billed the insurance company. I didn't have to do anything but just show up, get adjusted, and go home stress-free.
I haven't seen the bill. I don't know what's going on. I got insurance, so that, but I haven't kicked out a dime, a penny, or anything, okay? So it works great.
I'd be remiss if I didn't mention that I've been treated very courteously by the staff, and I don't feel like I'm coming to a strange place. I feel like I'm coming to a friendly place,
But he cares more about us than he does the money.
At our center, you could put your burden down and really get taken care of. We'll do it right the first time. Take care of every little thing. Make sure you get the best of everything.
Unique, different, and so much love and caring, and it's genuine.
He's giving me hope that my back is going to feel better and that I can start being able to play with my kids.
I tell you, he did a hell of a job, and I thank him for that.
So I know he's making a difference, okay? A big difference.
Go see my Dr. V. He can help you a lot. He can do you some justice.
I'm living proof. I'm living proof of that.
If you've been in an automobile accident and you're suffering from any of the whiplash danger signs, neck stiffness or soreness, headaches, back or hip pain, dizziness, loss of sleep, numbness in the arms or legs, or irritability, call 394-CARE immediately. Waiting to get better is dangerous. Your problem may get worse, doing permanent damage to the spine and nervous system. Don't wait. Call Care Chiropractic now at 394-CARE. Relief is just a phone call away. Call 394-CARE. Call now. 394-CARE. That's 394-CARE. You have nothing to lose but the pain.